Hi, I'm Arpita Ravishankar. I'm a consultant psychologist at Ethos Center for Thought Care. I've been specialized in dealing with couples therapy at the center right now. So, couples who face problems differ in a lot of areas. Firstly, the most important thing most of the couples face nowadays is communication issues to start off with. Secondly, intimacy issues, leadership and role reversal issues, and also culturally, when we see in India especially, a lot of with balancing between family values and their own lives, and also interference with the families. These are the major issues which I have seen with. Every couple who comes in here is different depending on the kind of problem they come with. So, most of the couples who come here do expect that their problems be solved, and sadly, they expect the partner to change. So, which is a little difficult to start to begin with. Because what happens in couples therapy is how we function here, or how couples therapy or counseling functions is where first you recognize what the issue is between both the partners, and then they make them aware of the patterns that they come with. For example, if their communication pattern, so you realize where they grew up with, what was the kind of family background they come from, what have they seen. For example, if somebody hasn't seen not expressing or solving problem at home, but they don't talk about it when there's an issue, that's how they've grown up in an environment. When they come into their adult life or in their family life or in their marital life, they wouldn't want to talk about the problem but rather leave it at it because it was never communicated in the family environment. So these are something that we look forward and recognize the patterns of behavior they've ingrained, and then make a mutual change in both the partners to come to a compromised consent change of positive behavior. In couples therapy, we usually would like to see both of them, and we always encourage for both the partners to be present. And only in extreme cases of, say, for example, domestic violence or abuse, or when you see a marked difference in one partner or is undergoing an issue psychologically or something, only then we try to separate, see them individually and work on their individual issues, and then bring them combined. Actually, how couples therapy works out is the first session when they come in, you usually try to understand, take an intake process. You understand what their problems are, what they're expecting from therapy, what are their goals is, are they willing to work on their relationship or not. And then followed by an assessment session that takes about 2 to 3 sessions minimum. That is the second and the third. That would be where you're trying to gauge their environment, family commitments and all that. And then based on that, we formulate a case as to what needs to be helped them with, and then based on which formulation an intervention is based. So altogether about 12 to 14 sessions is what is needed to address an issue in a couples therapy. So individually we don't really encourage. Yes, definitely it is worth it. That is only if both the partners who have compromised the relationship are present and want to work on it, and each again, it's not like most of the other psychological issues where patients come in with. This is very difficult because there are two individuals there, and each one have their own specific agenda and goals to accomplish. So if both of them are present and are willing to work on it, it's definitely worth it. From the recent studies that I've shown, 3-4 studies say that about 55% of them find satisfactory and really work on it and see positive changes in the 6 months of after receiving therapy. After 6 months, they'd see a very good positive change, and about 30% see a positive change even after 1 year of receiving help or therapy. And then sometimes it also shows that about 26% see there is deterioration. So when I ask the question, which the question is wrong, when what they want to ask is not whether couples counseling is working. What they want to ask is, does couple counseling or marriage counseling will help them save their marriage? So that is the question that needs to ask. But sadly, the thing is, it never comes out that way. What is couples counseling can also be that where you tell two individuals that relationship is not working for them and it is not good. So there is separation also which takes part depending on what is good for both of them. So yeah, it definitely works if people are willing to do it.